Dizziness is a common complaint. It can include anything from lightheadedness to balance issues or feeling like you're in a spinning room. Because dizziness can be caused by so many factors, your first stop should be with your primary healthcare provider. After a thorough evaluation, you may be referred to an otolaryngologist. These are doctors who specialize in the ears, nose, and throat. They also diagnose and treat balance issues related to the inner ear. The most common kind of vertigo is called BPPV, short for benign, paroxysmal, positional vertigo. It happens when small crystals of calcium get loose in your inner ear. You may feel it when you're getting in or out of bed or tilting your head up. People over age 60 are more likely to get BPPV. It's also the easiest type of vertigo to treat. We talked to Dr. Judith Milstead, an otolaryngologist at Lake Ear, Nose, Throat, and Facial Plastic Surgery. She explained the symptoms of BPPV and some of the treatments available.
We do help people with dizziness. It's just very common. There's a difference between dizziness, lightheaded, and vertigo. Now, lightheadedness doesn't usually come from the inner ear, but the vertigo, the spinning kind, does. And vertigo is very, very common. And it's something that scares the bejeebers out of you when it happens. You know, the whole world starts twisting around, going, oh my goodness. It happened to me, and I even knew what it was, and it was still scary, you know? So they can come in and we can tell them, oh, it's just your inner ear. It's more of a nuisance than anything else, but don't worry about it because it's nothing dangerous. If you have the calcium crystal issue, you know, just look it up and over your shoulder, that'll bring it on. Or the biggest thing is turning over in bed at night. Get up to go to the bathroom or get up for whatever, the room starts spinning around and you're going, holy, you know, what's going on? And that part is very scary when it first happens because it's dramatic. But usually the first day of that is the worst, and then you kind of get better after that. That's the most common kind. That's called a positional vertigo. And you can actually help, quote, cure that, but of course it comes back usually. It doesn't stay away forever. To treat positional vertigo, you can take a vestibular suppressant, but we have a physical therapist who is excellent at performing the particle repositioning maneuver, and that is curative for a lot of the patients we see.
If you believe you have BPPV, your doctor or a therapist can show you how to do these moves with the hope of providing relief. You'll find this story as well as links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery when you click the Stop the Spin StoryLink icon on our homepage at yourhometownhealth.com.